Hi, I'm Andrew McNeese. This is Safety 101, Lesson 1, titled Awareness. It's said that knowledge is power, and that's especially true when it comes to personal safety. With the presence of psych, geri-psych, and other patients in crisis, an environment can be created that's outside the norm for healthcare. The purpose of this lesson is to broaden your knowledge by sharing with you the perspective that we have when we're called upon to assist you with a problematic patient. As clinicians, when you enter a patient's room, you probably see someone in need. They may need medication, they may need food, they may need assistance using the restroom facilities. You may need to collect vitals, perform diagnostics, or other care necessary for the patient's welfare. But when we enter a patient's room, we don't see any of that. We're looking for threats. We're listening to the patient, each word he says. We're watching the patient's body language. We're looking around the room for things that can be improvised as weapons, and we're always anticipating ways to move you out of the way in the event that the patient becomes violent. In the same way that our focus and training can cause us to miss clinical issues that you might see right away, your focus and training can cause you to miss cues and actions that could expose you to potential danger. In this lesson, we're going to focus on verbal cues, nonverbal cues, and 3 specific areas of danger. Okay, let's talk a little bit about verbal cues. People who aren't accustomed to violence can easily dismiss verbal cues as simple venting. The problem in a clinical setting is that people tend to be under atypical stress and can experience diminished impulse control. For that reason, it's important for clinical staff to pay close attention to what their patients are saying. Statements like, "Get away from me, don't touch me, I don't want you here, you're making me angry, I'm going to hit you," should immediately alert staff that a patient could act out physically. When you hear statements like that, don't dismiss them as simple venting. Let's talk a little bit now about nonverbal cues. Throwing things, slamming things, clenched fists, clenched teeth, finger pointing, pushing away, trying to get out of bed, trying to leave the area can all be precursors to violent behavior. When a person is exhibiting these behaviors, they're showing that they're losing their ability to maintain self-control. Don't dismiss this when you see it. When you see these behaviors, understand that a patient may become violent. Now let's talk about 3 sources of physical danger: the arms, the legs, and the teeth. The most dangerous part of the arm is the hand. The hand can be used to grab, the hand can be used to slap, it can be used to punch. The most dangerous part of the hand is the fingers. A finger grab and twist can break your finger very, very quickly. Fingers can also be used to pinch and to scratch. A scratch on the arm is bad enough, but imagine a scratch across the face and across the eyes. That could produce a very serious injury. Now, I want to show 2 common weapons that are used against healthcare providers. A simple pen in the hand of a patient can be used to stab a caregiver in the neck just that quickly. Be careful where you store your pens. Once they're in the hand of a patient, you could be in jeopardy. A stethoscope can be used to draw a caregiver in towards a patient. It can be used as a ligature, and it can be used as a flail. The end of a stethoscope contacting the orbit can break the orbit, it can damage an eye, it can chip a tooth. Be very, very careful where you store your stethoscope when you're dealing with potentially violent patients. Remember, anything a patient can get their hands on can be used to hurt you, including your own hair. When controlling a hand, try not to allow any part of your body to get into the hand. If you're grabbed like this, push for a second against the hand and then pull yourself through the thumb and fingers to free yourself. When controlling a hand, it's better not to go palm to palm, because when you do, it allows the patient to interlace their fingers with yours, and then with a quick motion, they can grab a finger and break it. Better go palm to back of hand. That protects you from their fingers. While it's important to remember, keep an eye on the hands, don't forget the dangers of the elbow. The elbow can be used to cut under the chin, into the side, into the midsection, and also can be used to create a crush injury between your hand and the bed rails. As a general rule, if you're within the arm's length of a patient, you're within a danger zone. Now let's talk about the legs. Most people focus on the feet when they consider the legs because they are worried about kicking and stomping. That's important. Be aware of that. But don't forget about the knees. The knees are especially dangerous during a restraint procedure when a patient is in bed. Knee can easily be used to connect with the face or the midsection. Also, the knees can be used to create crush injuries between the hands and the bed rails or other bed components. And finally, let's talk about the teeth. Never underestimate a patient's willingness or ability to bite. During a restraint process, when controlling the upper body, often our biceps end up right above the shoulder area, and it doesn't take a lot of movement for a patient to rotate their head and lean just a bit and connect with that bicep. So be aware of that. Also, when a patient has you by the arm, they may try to pull your arm upward so that they can bite. If they're unable, though, to pull that arm up, a common tell the bite is about to happen is when they do this forward motion or this lowering motion of their body because they're trying to get the teeth down to the fleshy part of your arm. So be aware of those. As healthcare professionals, it's natural to presume that patient care comes first, and in most cases it does. But when dealing with patients who may be psychologically compromised, the addition of an awareness of verbal cues, nonverbal cues, and how the arms, the legs, and the teeth can harm you can make the difference between your safety and becoming a patient yourself. I'm Andrew McNeese. This is Safety 101 for Healthcare Providers, Awareness.